It takes a caring heart to work with people in need of medical assistance, and our next guest doesn't think twice to provide that care. Let's meet a licensed practical nurse. Hi, I'm Viviana.
I'm Sarah. Welcome to St. Paul's. Let me show you around the best ward in the hospital.
Sounds good.
My name is Zoe Pichette. I'm a licensed practical nurse at St. Paul's Hospital in Vancouver. I'm the first stop and the last stop when you come into the hospital. And I'm the one that assures continuity of care. I come in the morning and I take a report from the previous shift, and then I go and I check on all my patients, make sure they're okay. I'll administer medications, injections, I'll do wound care, I'll monitor your ins and outs, which means how much fluids that come into your body. The majority of my job entirely surrounds all the assessments that I do of you during the day, and I document everything. The difference between a registered nurse and a licensed practical nurse is entirely defined by my scope of practice. My scope of practice states that I look after stable patients with predictable outcomes. So the sicker you are, the more chances you're going to be with a registered nurse.
So what goes on in here?
Well, this is the nerve center of the unit. That's where the unit coordinator sits and directs traffic. I check lab values. It's also where we house all the charts. I work 8-hour shifts, 6 days in a row, 2 days off. When you start off on an on-call basis, you take the hours that you're given. There's nothing really specific in terms of hours. You just can't be afraid to work the long hours or the short hours. There's 2 ways to become a licensed practical nurse. You can either do the Access to Licensed Practical Nurse Diploma program, or you can do the generic Licensed Practical Nurse Diploma program. You have to have your grade 12 math, your grade 12 biology, your grade 11 chemistry. Within the realm of being a licensed practical nurse, you can work on different areas. So acute care on the medicine program, like at St. Paul's. You can work in maternity. You can also work for the College of Licensed Practical Nurses of BC. You're able to transfer some of your education and your experience towards becoming a registered nurse. As a licensed practical nurse, you have to be comfortable enough to speak with people. You need to glean information from them, talking to them and making them feel comfortable and trust you with their personal information. I do a lot of patient teaching. I explain the procedures that's going to happen to you, the little things that you can expect during your hospitalization. All right, so we're going to be checking in on Catherine this morning.
Hi, Catherine.
How are you feeling today?
I'm all right. A bit tired.
Yeah? Do you have any pain anywhere?
Just achy.
Do you want to take her temperature?
Sure, I would love
Okay.
to. All right, Catherine, here we go.
Oh, excellent.
Is that normal?
Yeah, 36.8, that's exactly where we want it, so no fevers. You have to be extremely good with your hands at this job because you hold many little finicky tools and you're doing many things with your hands at the same time. This entire job is about paying attention to detail, and it's tiny little things that people would think are innocuous are sometimes the most important.
So how often do you have to check up on your patients?
Every hour,
Every hour.
minimum.
How many patients do you normally have?
It depends. It depends if we're short staffed or fully staffed, but it can go anywhere between 4 to 6.
So you really have to be organized and manage your time properly.
That's an understatement. The top 2 skills that we need to do is priority setting and time management. I've saved lives. I've been there while doing CPR and chest compressions, and the doctors are there and you get a heart rhythm back. That feeling, that gratification, you go to bed knowing that you've been productive and you've been a good person every day.
Sarah, thank you so much for showing me around. It really is the best ward in the hospital.
Thanks for coming, it was fun.
Once again, I'm Viviana for Career Trek, reminding you that this career could be